quick introduction. My name is Bridget Ezobiakor, and I am a healthcare professional, and I love what I do. And in this channel, I attempt to work with healthcare professionals, leaning from my training and experience and passion, and helps us to bring passion and skill together. So we're very practical here. All right, relax and welcome. So I've been on a series talking about interviews, what to do before your interview, how to prepare yourself, how to stand out. And today I really want to talk about something I've seen that has been growing in the trend. And I just feel that I need to address it because in your own point of view, you are acing it, but the interviewer at the other end might not really be impressed. And this is for people that are applying for a job, people that want to work in the health and social care space, be it that you're going for an interview to be an occupational therapist, a social worker, a healthcare assistant, a support worker, a senior support worker, whatever area of the healthcare space, nurses, doctors, all of us, we're all healthcare professionals. So when you are going for your interview, I have seen people they ask you questions and you just replay something that you have crammed in your head. You know, what is safeguarding? Well, safeguarding is this and that and that and that. And you just quote it just the way you saw it online or in a book. And that's it. You know, the truth is, because most of the people that are interviewing you, you're not the only person they've interviewed. They've done quite a lot of interviews. They know the lines and they've studied as well. They know what they're doing. So if you're just repeating the lines, it appears like, you know, what is safeguarding? Most people, in my experience, I don't say what is safeguarding anymore because you're just giving them the opportunity to just reread that safeguarding is protecting any individual from who is vulnerable from any form of abuse, harm, or well, it is the definition, but it's not a definition that you will use when you're at work. So, you know, it's always better to, you know, attach it to an experience, your experience. It shows that you have a broader knowledge, you know. And I wouldn't say, for instance, if you are asked that, can you give a scenario where there was an incident that required escalation due to the severity or the exposure of the vulnerable individual to some form of injury, and it is by reason of another person? Can you explain in your experience what you will do, what are the steps, and what should be the outcome? Now, what they have asked you is probably an abuse. You know, somebody was exposed to injury because of another individual. So it can be physical abuse, it can be emotional abuse, it can be sexual abuse, it can be anything. So you can say, well, I believe what has happened there is a form of abuse, and if it is causing a physical injury, then it's physical abuse. If it is has smeared the person's emotional state or mental state, then it's an emotional abuse, and the individual who has caused this on the vulnerable person is the abuser, and I believe it calls for a safeguarding concern. And in my own professional opinion, once I have witnessed that or I have been told, I will reassure the vulnerable adults and ensure that they are safe. If there is need to call the police because it's physical and, you know, or to involve a senior in the office, I would listen to them, I would reassure them, then I would document it as an incident according to the company policy, and I would expect that a safeguarding concern is raised. If it is within my role to raise a safeguarding concern, I will follow the company policy, raising a safeguarding through the appropriate channel, either the safeguarding lead or if it is the external body. And then you can say, well, in my experience in the past, I have experienced where I walked into a service user and I found a neighbor hitting them. And at that point, I had to call for help. So immediately, I made them know that somebody else is here, seeing them. Can you stop, please? Can you stop, please? And because I knew that if I get in the way, I will also be hurt. So I quickly called for help. And what did I do? I called the emergency service. I called the police. Immediately I called for help. I was staying within to see the safety of my service user, but I did not put myself in line of fire because I also needed to be safe to to protect my service user. And what else did I do? Probably once I received support, I ensured to check my service user. I called my manager in the office also. Once the fight had been separated and my service user was safe, I informed my manager or my line manager or the on-call person, and I followed the procedure of what the police advised, and then I documented. Immediately I had the chance to, I documented the facts, everything that I saw, and I recommended that a safeguarding concern is raised. You see, that is you explaining safeguarding without giving all those lengthy definitions that everybody knows. I'm not saying that you shouldn't give it. I'm saying that you should give it in a context of experience. It helps you. It shows that you really know what you're doing. Anyway, that's it for today. Thank you so much for coming again to my channel. And you know, the truth is, I have so many examples to give, and maybe in the next video I'm going to give another example that is not safeguarding. But the truth is, if you don't know, if you don't explain like you know, if you don't show that level of confidence, then you might just think you're reading it from somewhere. All right, thank you so much for coming again, and I'll see you in the next one. Tell your friends to tell your friends. Cheers.